withdrawal can be agonizing, and fear of going through severe symptoms can often scare addicts away from trying to get help. In case you missed it, we told you recently about a new device that promises to effectively erase withdrawal symptoms.
There's no denying it. The opioid crisis is at epidemic levels, and it's hitting every community in our viewing area.
Well, it could be a huge breakthrough in fighting the war against heroin addiction.
A small device that fits behind the ear is helping addicts get clean and sober.
Good evening. There is no perfect answer, but towns and cities, big and small, are seeking solutions. A recently approved device made right here in our state is showing some signs of hope against the battle being fought 24/7.
A Versailles company called Innovative Health Solutions created the small device. Several medical facilities in our area are using it to help patients.
Well, the FDA approved a device to help reduce opioid withdrawal symptoms. It's called the Bridge. And what it is, as you're looking at it here, small electrical nerve stimulators placed behind the ear that emits electrical pulses, and it stimulates branches of certain cranial nerves. And then these stimulations, what they do is help provide relief from the withdrawal symptoms you may be going through.
It's a small electronic device that fits in the palm of the hand. It's called the Bridge, and medical professionals are hoping more people can use it to beat heroin and other opioid addiction. The Bridge goes behind the ear, and it works on nerve points on the ear.
Couple are here for this.
The Bridge, through neurostimulatory pathways between the ear and the midbrain, kind of blunt the effects of withdrawal and inhibit the cravings of addiction.
Currently, it's only available by prescription. It's used in hospitals, community health centers, private doctors, and centers as well that deal with addiction. And you can use it up to 5 days during the acute withdrawal phase. I really like this because it doesn't use, one of the big issues with opiate addiction is using more drugs to treat it. This is a new way of treating it without using more drugs. And pretty impressive results in a study.
Katrina Locke is a nurse practitioner at Florence Medical Group and Rising Sun Modern Medicine. She's been using the Bridge since last fall and says it's been more effective in helping her patients battling the symptoms of withdrawal, like severe pain and nausea.
And it works almost immediately. Within the first few minutes of having it on, almost their symptoms go from being really, really bad to being almost nothing.
Every addict recognizes the symptoms of withdrawal.
Hot and cold, restless legs. Oh my God, it's so uncomfortable.
Why are you here?
I'm addicted to heroin.
A week ago, Serena was fitted with the Bridge device. It uses electrical impulses to help recovering addicts cope with withdrawal symptoms, which can be severe. The results for Serena, almost immediate and dramatic.
How soon after, the doctor placed it in your ear, did you feel it?
Within minutes.
For Thomas, it's a similar feeling.
How are you feeling?
I feel great. I'm amazing. I can't even put it in words.
After a total of 30 minutes,
I'm actually feeling a lot better. Most of the irritability went away. Anxiousness, most of it gone. Not hot, cold anymore. I feel like I can handle it for the most part now.
It's giving me my life back. I have zero cravings. I have zero desire to ever go back to another painkiller, maintenance medication.
So everyone was seemed to be seeing some benefit.
And it makes sense, that so-called mastoid area behind the ear, that's sort of grand central station for those cranial nerves. You have the 5th, the 7th, the 8th, the 9th, the 10th cranial nerves. They have feedback mechanisms to the central nervous system, may affect the sympathetic nervous system. Physiologically, neurologically, there's a reason why this may be.
The first time I was shown the Bridge device to use in my office, I was the same as her. There's no way that this is going to happen. I've seen videos on YouTube of how well it works, but when I saw it actually working, it's amazing. You were talking about the COWS scores, the withdrawal scores. They dropped from super high to almost zero in a matter of a half an hour to an hour.
I want to ask you, because a lot of us are hearing about this for the first time. I know it's newly FDA approved. It feels as though this is something that most people going through withdrawals should consider using. Is it getting out there so that most treatment centers are having access to a treatment like this, or is it still so new that it's only now being discovered even by addiction specialists?
It is relatively new, and
all right, well, Raphael, this device is Indiana made. So how much does it cost and where else has it been used?
It's been tested in Alaska, Ohio, as well as Utah. The cost, $700. Of course, that's without the insurance. They're working with insurance companies to try to pay off some of those bills. Of course, if you use it, it has received approval from the FDA, and they are working on making sure that insurance can cover a portion of this device.
So we can see it in more states just beyond here?
We could see it.
Yeah, all right.